So remember the other day when we were talking about the cortisone shots, and somebody called us, Dom, right? If I remember correctly, was telling us about the cortisone shots that they had received, and
Chris Wood
and
just
what.
had a shot in his wrist.
That's right. It was Chris Wood. Yeah, and I was trying to figure out. Okay, so does it? Did you get it to help the body heal, to bring down the inflammation, or did you get it to mask the pain so that you could continue doing whatever it was that you were doing? In his case, obviously playing professional golf. So we reached out to Dante Implicito, our friend from the New Jersey Spine Medicine and Surgery Center, the orthopedic spine surgeon such that he is, joining us right now to answer this question and more that are plaguing us. The good doctor, how are you?
Very well, Matt. How are you doing?
I'm doing well, thank you. So what is a cortisone shot? What does it do?
So cortisone is a very, very strong anti-inflammatory. And in fact, it reduces inflammation. And when you think of anti-inflammatories, they fall into two categories. One is they are called steroidal anti-inflammatories, and the other one is non-steroidal anti-inflammatories. So non-steroidals are the ones that everybody knows about. That's the Aleve and Advils and Motrins and ibuprofens that are readily available over the counter. And then the cortisone-based anti-inflammatories are they're steroid anti-inflammatories, and those are stronger, more potent, and much more controlled in how they're given.
All right, so let's go down the road with something that happens to people commonly, at least when you're talking about golf. Let's talk about, say, like a tennis elbow, if you please, right?
Sure.
Where, if I remember correctly, when you were on with us before, you were telling me that was kind of like little tiny tears.
Yes.
Am I remembering that correctly?
Yeah,
so you inject that with right? You put a cortisone injection in there. You dramatically, radically bring down the inflammation. How does that allow a person to go out and perform? Because didn't we just start with the fact that there are tears in there?
So it depends on where you're putting your steroids. So in the incidence of tennis elbow, which if your palm is facing up, it's on the thumb side of your elbow, as opposed to golfer's elbow, which if your hand's facing up, it's on the pinky side of your elbow. There you have a problem with the way the tendon attaches to the bone. And as you said, there are small, tiny little tears in what's called the origin, where the muscle mass begins on the elbow. So when you use it in that sense, there's two things. First of all, there's a great amount of inflammation around the tear, and when the injection is properly given, the cortisone stamps out the inflammation. But the other part of it is that the tip of the needle is used to scratch the bone a little bit. And that stimulates a little bit of bleeding, and then the bleeding helps to sort of heal those tears. So in that particular scenario that you described, what it does is it's twofold. It reduces the inflammation. That's the cortisone part, but the actual intended trauma of the needle scraping the bone causes it to heal. I actually did this myself about 3 weeks ago after suffering all season.
Seriously?
Yeah, I had a miserable elbow for about 6 weeks, and had a buddy of mine injected in the locker room, believe it or not, 2 weeks ago.
You said to one of your doctor buddy friends, "Hey, bring a cortisone shot."
Yeah.
All right, fair enough. All right, so you just kind of led me down where, as you're talking, a question was popping in my head. Then you said you did it yourself. At what point should somebody go, enough is enough? I want to get the shot. I don't want to have this pain. I want to get a cortisone shot or whatever course of action that medically you guys recommend. Is it better to do it sooner than later, or is it better to wait weeks and weeks like you did and finally get it done when you just can't take it anymore? Is there a downside to doing it, in other words?
So again, it's a matter of what you're treating. So when you inject cortisone into an area where there's a tendon, like in the tennis elbow example you raised, there's a downside. If you inject too often, you risk tearing the tendon completely.
Because you can't feel it?
Yeah, so there are kind of rough guidelines that you don't want to do that more than, say, 3 or 4 times over the course of your career or over the course of several years, because you can risk rupture of the actual tendon, and then you have a bigger problem. However, certain other places where you would put cortisone, for instance, you can inject cortisone into a knee joint or into a into your spine, which we call an epidural injection. In those scenarios, there's no tendon there, so you can actually tolerate doing that more often without risking kind of the long-term consequence of the injection.
All right, so hold on. Let me understand something for a second. You just mentioned a knee and injecting a cortisone shot into the knee, and that we're not dealing with a tendon that could tear all the way because we're not feeling it. Blah, blah, blah. If you're injecting it into a knee, and maybe I'm completely naive here because I haven't had knee problems, thankfully, but isn't part of the problem with the knee that people say it almost feels like bone on bone? So what would the cortisone do?
So again, cortisone always is an anti-inflammatory. So if you have a knee that is mildly arthritic, so you've had some cartilage damage and the knee is starting to really degenerate, perhaps not bad enough that you need a knee replacement, but if you can control the inflammation, you can make someone a lot more comfortable. So one of the temporizing measures we use is we will sometimes drain the knee if there's excess fluid in it, but certainly injecting the knee with cortisone will help reduce the inflammation and allow you to be more functional. So to get back to your question before about when you actually pull the string and do that, it really depends on your kind of situation in life. I mean, most of us don't like to do it unless it's a problem that's already failed non-invasive measures. So if you've done a little stretching and physical therapy, if you've taken anti-inflammatories, over-the-counter anti-inflammatories by mouth, and those haven't been successful, in that scenario, that's when we start thinking about an injection.
How long does it last, doctor?
So the medication will stay in your system depending on which cortisone is kind of a broad name. There's several different steroids that are sort of referred to as cortisone injections. Oh. So it depends on which of those medicines you're talking about, but they'll stick around in your system for a month to 6 weeks. However, the effect can certainly be long-lasting.
All right, the tennis elbow thing, or the golfer's elbow, as you put it, which it was golfer's elbow once you gave me a definition that I was dealing with, is something that I've had twice.
Okay.
And in both cases, I never got a cortisone shot. At times it hurt like hell, but I just soldiered through it. But it ended up healing up. And right now it's fine. I'm back to lifting again and basically doing whatever I want, and it really doesn't hurt. So from that standpoint, medically, when you have someone that comes to you and says, okay, you've had this, a couple times in the last 10 to 20 years, doesn't sound that bad, that you need to really take a look at too much. But as an athlete yourself, doctor, and as a player yourself, at some point, does it cause you medically to say to somebody, you might want to have somebody look at what's causing the problem? You know what I'm saying?
Yeah. So exactly right. Most of these things are sort of overuse injuries or repeated trauma injuries. So particularly in golf, if you end up grounding the club several times, you probably feel it. And then do it enough, and it becomes a chronic issue. So sometimes in the case of a particular athletic event like golf, we're talking about maybe a defect in your swing or your grip or something else. But you're absolutely right. When things get bad, that's when we get sort of a little more excited about it. We'll do MRIs to kind of narrow down the source as opposed to treating the symptom with either a brace or some stretching exercises.
Dr. Dante Implicito is our guest. I got two quick questions before we lose you. First of all, as adaptive, as incredible as the human body is, does it get to a point where the impact of the shot itself starts to diminish because the body starts to, I don't know, get used to it or adjust to it or what have you, however you define that?
So yeah, I mean, certainly if you're focused on what you're doing, you can adapt. But when the inflammation's bad, as you can tell. You suffered from it yourself. Sometimes when it's not just the golf course and you can't pick up your coffee mug without hurting your elbow, then it's time to see somebody.
Yeah, I couldn't shake somebody's hand after a while. It hurting so bad. But again, I just kind of soldiered through and I went away. So that was fine. Yeah, that was fine. Now here's the other question I wanted to end with. When you have a world-class athlete, are there additional considerations? Are there additional concerns, like you said, maybe making a complete tear or what have you, that you have to take into account, say, when you're dealing with someone that's professionally playing whatever their particular sport is?
Yeah, I'd say the biggest adjustment you need to make is you have to think about their season, because most of the sports we're talking about will have a particular aspect of the season where it's busy and very, very important to them to get out there and make their living, and other times where they have a period of time where they can do some selected rest and some selective physical therapy and other treatments. So a lot of times it has to do more with the timing of where they are during their actual season. But yeah, there are considerations. If this is somebody's living as opposed to somebody who picks up a phone for a living, they can always use their other hand. You're certainly very careful in your decision making when treating an athlete.
All right. Yeah, somebody just sent me a tweet, by the way, Dominic. It said it was FYI. He says it was Fats Domino that passed away, not Chubby Checker. So we correct that. All right. So, Doctor, let me ask you this question. Last question. Just another one popped in my head.
Sure.
Are you in any way concerned out of what you're seeing from Tiger Woods right now, the pace of his comeback?
No, actually, I think he's right on schedule. I mean, we had spoken way back when he was initially injured a couple of times, I believe, and he finally had the right operation. He had a situation where his disc was shot, for lack of a better term, and the way to do that is to remove the disc entirely and fuse the two bones together and take the time to let that heal. And the way he was managed this time seems to be exactly appropriate. And then once you're turned loose, it's a matter of getting the swing memory back and building the muscles. And the swings I've seen online certainly look like he's moving in the right direction. I think the time.
You guys aren't sitting around, a bunch of doctors sitting around a table, kind of raise an eyebrow at each other and go,
We did that actually after his last surgeries when we thought he was coming back a little fast. This time we think he's right on schedule.
All right. We're probably going to take that quote from you and send it out. Dr. Dante Implicito. My friend, thank you very much for sharing all this with us. It's, you kind of said it, because I was going to ask you when, nuts and bolts, when should somebody consider doing this? You pretty much said when you can't even pick up your coffee mug, maybe it's time. I don't think that's a bad way to define it and leave it in those simple terms for someone simple like me. So, but I do very much appreciate you joining us again. I know yesterday you were going to, and you had 7 hours of surgery, a guy that's doing real stuff. So thank you.
Anytime, Matt. My pleasure. Take care.